Demi Lovato, Kanye West, Mariah Carey, all famous artists who have one more thing in common. They've all been diagnosed as having bipolar disorder. The World Health Organization says the same mental illness affects 45 million Americans or people worldwide. Dr. Jada Jackson is a licensed mental health counselor and joins us to tell us what signs to look for and how you can support loved ones who may have issues with this. Good morning. Thank you for being with us.
Good morning, Jane. Thank you.
Good. There's so much about this out there these days, and people try to make it so simple, yet there's no consensus on what causes bipolar disorder. Some doctors believe it's behavioral, family systems. Some people believe it's biologic, right?
That's true. You're absolutely right, Jane. And mental health professionals don't know what causes bipolar disorder. But here's one thing that we do know, that there are very specific symptoms and criteria that help clinicians treat those who suffer from the disorder.
Okay, and I want to talk about those symptoms that people can look for in just a second. The reason that the cause is important is because it provides hope. Maybe therapy can help, that kind of thing. But let's talk about the symptoms that you might look for. If you're noticing things with a family member and you're like, are they just depressed or is this anxiety? What's going on here? What are the specific symptoms of bipolar?
The very specific symptoms of bipolar would be, and we probably say this all the time, but just very high highs and then very low lows. The significant shift in moods and symptoms really make it challenging for people with bipolar disorder to have healthy, significant relationships.
Well, so let's say that you have someone in your family who you're seeing this with. The last thing you want to do, I think this is correct, is shame that person because they probably already may feel a little bit of shame. So how do you approach someone in your family or a friend who you think this may be a problem for this person?
Absolutely. The first thing that you want to do is make sure that you are not shaming. You know, we really want to make sure that harm reduction is first and foremost, because we do not want to push that person away. But learn as much as you can, support when you can, be patient. But I also say make sure that you have a safety plan, because people with bipolar disorder oftentimes can become physically, emotionally, and psychologically aggressive. So you also want to be willing to acknowledge when professional help is necessary. In other words, don't try to be the clinician's superhero, right? You want to make sure that you seek professional help for sure.
So, well, that's what I was going to say. When you say a safety plan, to me, that says have someone in mind who is a professional who you might be able to take this person to. And so my question is this: when you go through insurance stuff and you see all this myriad of people and you have no idea who's good with bipolar, who's not. I mean, everybody's listed as a psychologist, a therapist. How do you figure that out?
Yeah, you're right. It really is difficult. But if you have health insurance through your employer, your EAP or employee assistance program will have great options for you to look at. It'll narrow down all of the credentials of a therapist and a psychiatrist. And then another tool that I like to use is Psychology Today. It highlights all of the areas of interest as well.
Okay. What does a situation like COVID, where we have a lot of additional pressure, anybody has additional pressure and anxiety right now, does this exacerbate things like bipolar?
Absolutely. Absolutely. Increased sadness, increased worry. You know, the pandemic escalates stress levels in general. And just think, for a person who doesn't have bipolar, you know, the quarantine, the isolation, all of that triggers feelings of sadness, alienation, anger, frustrations. But for someone with bipolar disorder, these triggers become magnified and overwhelming. And right now I'm seeing an increase in domestic abuse and violence. And it's been very difficult for many of my clients to just deal with the shift in what we're facing with the pandemic.
Well, you know, I've had my own experiences with depression, some other things in my life, and I'm a huge advocate for not being ashamed of any problem that you have and getting treatment. So what hope do you have to offer people who may be facing an issue like this, families who may be facing this? There's a lot of hope out there.
Absolutely, Jane. You know, I love what I do and I really trust the process. And I believe that all of us need strong emotional and psychological toolboxes to help us through life. But when it comes to managing bipolar disorder or any other mental health condition, my encouragement is to seek professional help. So, you know, resist the temptation to tackle the issue alone. There are many of us clinicians who are trained, you know, to walk through the process with you, the challenges of mental health. So I just encourage everyone to use the resources that are available.
Some of the most well-adjusted people I know are those who've been in therapy.
You got it. Absolutely. I concur.
All right. Thank you so much for joining us, Dr. Jackson. Really appreciate your help during this difficult time for a lot of people.
Thank you.